I'm Dr. Vikas Kohli. I'm a pediatric cardiologist. I trained in the US and I've come back to practice in India. For last almost 3 decades, I'm practicing in North India and I'm associated with children with heart disease. I work in a private hospital, but I also run an NGO. About children with heart disease, this is the most common birth defect. So 1% of all children, that means 1 out of 100 babies will have a heart problem. And it is the least commonly diagnosed birth defect on ultrasound during pregnancy. It is the most commonly missed birth defect at time of birth and the most common cause of death from birth defect under 1 year of age. This makes it a very important condition to diagnose early, and the value of the early diagnosis is that earlier it gets diagnosed and treated, more is the likelihood that subsequently the child will lead a normal life. Majority of the children, 70% of children who need treatment, when they get treated, will lead a normal lifestyle in terms of education, sports, physical activity. 30% patients may have some limitation or the other. Majority patients will not require a re-intervention. So this is a condition where the child will lead a fruitful, happy childhood and adult life. But one of the things I want the patients to know is once a CHD is forever a CHD. They always need a follow-up because in small number of patients, we need to look at other structures in the heart as the child's heart grows, because there may be a small problem here and there which may need medication or an intervention which may crop up over a period of time. I would like to emphasize that over the last 3 decades, the diagnosis has improved tremendously. This has happened because of several reasons. One of the reasons is that the manpower which is needed to diagnose has increased multifold, and it needs to continue to increase multifold. We have about 600 districts in India, but we don't have 600 pediatric cardiologists yet. So we need to get enough doctors so that at least one doctor per district is there to be able to diagnose the condition very early in the life of the child. This is one major change which has happened in 3 decades. Second major change which has happened in 3 decades is the number of institutions where these children are treated have multiplied and almost doubled or tripled. But this change has significantly more so happened in South India than in North India. So we need more institutions in North India. Government has been very critical in supporting the treatment, establishment of institutions, opening more AIMS institutions in whole of North India, and getting more doctors trained via DRNB program and DM Pediatric Cardiology program. And we as doctors who are treating these children are never satisfied with the progress. We seek even more and more support from doctors for treating every single child who is there who has congenital heart disease. Now, what is the treatment that is available? Of suppose 100 children requiring heart disease treatment, about 70 will require surgery, 30 will require intervention. The percentage continuously increases with more and more interventions happening than surgeries. But approximate ratio is 1 in 3 children will require intervention and 2 in 3 will require surgery. So surgery remains to be the dominant treatment in these, and that's a one-time surgery in majority of cases. In small number of complicated diseases, they may require more than one surgery. Intervention is beautiful. The child gets admitted, gets the device or the implant, and goes home the next day 24 hours after the procedure and leads a normal life. There is no cut, no stitch, no blood transfusion, no scar on the body. And when the child grows up, he may not even know, or she may not even know that this has happened. So this is the beauty of this condition. And I would like to emphasize that every child who's gotten treated, please continue for follow-up with your doctors so that you remain healthy throughout your life. You grow up to be an adult, you may become a parent or may get pregnant and still may need treatment and follow-up as that happens. So this is a very important point about urban and rural divide. What happens in urban areas, the child is born in a hospital and an ICU where the child's diagnosis is made relatively early, 24-48 hours. But majority of the children in rural areas do not reach a point where, if they are critical early in life, that they will make it. Unless we touch this segment of children, we will not be able to improve the infant mortality rate in India, which is in the 20s or low 30s, will not come down to single digit till we hit the rural congenital heart disease and birth defects. So we have to reach a point where India is not anymore a country where we are losing children from diarrhea, dehydration, malnutrition. We are losing them from major problems which need high-end treatment, like heart disease, like surgery in the first month of life or first year of life. So this is where we need to address, and which makes it very important and imperative that we involve the government and non-governmental organizations in early detection and early diagnosis of congenital heart disease in rural areas.